Hello everyone, it's Dr. Dave. Hopefully you're all doing well. You had a nice start to your week, last week of April for 2021. Make it a good one. May will be here soon. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for April 27th, 2021. Gonna look at 6 areas of health and wellness somewhere around this video as usual. You can read through all 6 of those areas. If you'd like a copy, DM us on social, give us a call here at the clinic or send us an email. We'll be sure to get that to you. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, you just never know what your body's capable of when you give it a great environment. And we're going to help give you some strategies to do that based on the latest and greatest in the research and literature on health and wellness. So for example, in the Journal of Nutrition, Health and Aging for April 2021, they talk about omega-3 fatty acids and they're good for your mind and body. They looked at 142 older adults and researchers observed that those with a higher dietary intake of omega-3 exhibited better overall cognitive function, greater mobility, and faster walking speed. And isn't that something you would like to have for the rest of your life? Some good brain function, a little bit of good mobility and body function, as well as being able to walk along at a good clip because you still can. So making sure you have some sources of omega-3 fatty acids in your diet and or through supplementation is a good idea. The European Journal of Preventive Cardiology, March 2021, looked at the best type of exercise to reduce blood pressure. And according to this new report, aerobic activity is the best form of exercise to reduce blood pressure in individuals whose blood pressure reading is 140 over 90 millimeters of mercury or higher. However, those with the blood pressure in the high normal range, 130 to 139 over 85 to 89, should consider dynamic resistance training, while isometric resistance training may be most beneficial for adults with a blood pressure under 130 to 84, 130 over 84. So aerobic, if it's really high, blood pressure in the mid-range should consider more dynamic resistance kind of training, almost like interval training, high intensity perhaps. And isometric resistance training can be most beneficial apparently for people with lower blood pressure looking to stay in good shape when it comes to the blood pressure. So you may want to add that to your more dynamic or endurance routines to balance out some of the goodness for your heart, your cardiac function. So those are some good tips to live a little bit longer, omega-3 and different kinds of exercise to reduce the blood pressure. The Aging Clinical and Experimental Research Report, April 2021, looked at 3 keys to living longer. And they looked at data from a long-term study that followed over 1,700 men from middle age until age 100 or death, whichever came first. And researchers report that participants who did not smoke, ate a heart-healthy diet, and got regular exercise lived an average of 10 years longer than those who smoked, ate an unhealthy diet, and were physically inactive. So don't smoke. Make sure you're getting all the good stuff that you need every day and avoid as much of the bad stuff as possible when it comes to your nutrition. And don't be sedentary, and you'll get 10 more years of not just longevity, but probably even better quality by following those 3 steps. So those are some fundamentals. You can't go wrong by making those changes in your life. The Journal of Clinical Psychiatry, March 2021, looked at new moms being more likely to have OCD, an interesting correlation there. You may want to read about that. And for some reason, the Centers of Disease Control and Prevention in April 2021 decided to share with us that STDs are on the rise. So for those of you who may participate in activities that may increase the likelihood of exposure to such, you may want to know that that is the situation, and you may want to take appropriate measures to avoid getting into trouble in that respect. And finally, the International Urogynecology Journal, February 2021, looked at incontinence and how it's linked to musculoskeletal bone and joint issues and muscle, bone, and joint issues. While there are many potential causes for urinary incontinence, a systemic review of 15 studies identified an association between urinary incontinence and back pain or pelvic girdle pain. The findings suggest that evaluating urinary incontinent patients for back and pelvic-related musculoskeletal disorders, if no other cause of incontinence is suspected, that should be done. By improving some of those musculoskeletal and maybe neuromusculoskeletal components of any back pain or pelvic pain, they may see an improvement in their urinary function. Bladder function especially, all right? So lots of positive side effects to taking care of that body of yours, not just physical, but also the organs, glands, and blood vessels will benefit by taking care of all these little aspects that might be going on. So that's your daily health update for Tuesday. Keep you headed in the right direction, sailing towards the sunset and staying happy with a smile on your face when it comes to your health and wellness, so you can have those great experiences you're looking for every day. And I know you're looking for them. So you came to the right place. We'll help you create a foundation of health and wellness for you to get out there and do what you need and want to do every day. So we'll be back tomorrow, Wednesday, heading you in the right direction once again. We'll look forward to chatting with you then. Take care. Be well.